Greetings, my name is Dr. Chris Bird. I'm here to talk to you on behalf of the Texas Coastal Bend COVID-19 Task Force to deliver the weekly pandemic report for April 3rd, 2021. The task force has two objectives. One is to address public concerns and questions about COVID-19, and the second is to enable evidence-based decision-making on behalf of our local leaders. There are presently several interventions that are taking place to slow down the transmission of COVID-19. The first is that you're recommended to get vaccinated, and the reason why the pandemic report is late this week is because I got my second dose earlier this week, and I experienced some of those cold and flu-like symptoms that you've heard about. Hindsight 2020, I would totally do it again because the symptoms associated with getting the vaccine are much more mild than the symptoms associated with getting COVID. And I think that we still don't know of anybody that has died from COVID-19 after having been fully vaccinated. You're also encouraged to avoid crowds, wear face coverings and social distance, isolate when you're exposed or symptomatic. And even if you've been fully vaccinated, it's still not the time to take off your masks yet. Because you may be exposing yourself to COVID-19 in the community. Presently at nuesisnose.com, the risk of transmission of COVID-19 is still high. This is one step below the highest level, which would be extreme risk. And what we don't want to do is have a number of people that have been fully vaccinated exposing themselves to COVID-19, which is essentially filtering for variants that are resistant to the vaccination. Next, there's partial to all remote schooling that's still taking place, and obviously that's being done to try to slow down a point of transmission. Okay, let's get into the total number of confirmed cases. This week we're up to 42,132 total confirmed cases in the Coastal Bend. A confirmed case is one that was determined with either the gold standard swab/PCR test, and the other confirmed cases used other tests combined with a physician's diagnosis. Of those total cases, there's been 40,213 recoveries and 749 active cases right now. The active cases are up 10% over last week. Now, this is the first time in at least a couple months that we've seen an increase like this. And so it shows that we're turning a corner. The transmission rate is estimated to be at around 1.2, which is up from our last projection of 0.9. So this indicates that COVID is indeed spreading in the community, and it's not just a result of weekly variations. There's a long-term sustained trend of increasing COVID in the community now. What a transmission rate of 1.2 means is that for every 10 people that contract COVID, they transmit it to an additional 12 people total. And so that's not an extreme rate of spread, but it still is exponential in nature, where 20% more people are contracting COVID each week, essentially, regardless of how many people have COVID. And that's how exponential growth works. And it seems slow at first, but it can speed up fairly rapidly. To look at how this translates into numbers of new cases, here's our plot of the number of new cases per day in the Coastal Bend. Each point is the number of new cases recorded on each day. And then the blue line is our model fit and then projection forward in time. And what we're doing with the projection is we're just assuming that the dynamics stay the same as they are, or they have been for the past several weeks. And those dynamics are that for every person that's getting fully vaccinated, we have more than one person that's kind of going back to normal, if you will. And so that's resulting in a skew towards too many people going back to more risky behaviors, which were okay before the pandemic, than the vaccinations can sustain right now, which is now leading to this increase in cases that we're seeing. If this sort of trend continues, the projection will be accurate. However, if we change our behavior, we can make this projection be inaccurate. The way we change our behavior for the better would be to be more cautious, wear masks. If you've been vaccinated, continue to wear a mask. If you do those things, we can change this projection to be lower. Now, something I want to focus on this week is the age distribution of the cases. This is just from Nueces County, but what you see on this graph is the new cases per day for different age brackets. And the 0 to 17 age bracket are the youngest people in our community. COVID is increasing in that age bracket the most rapidly. You can see that this trend started back in the second week of March, and it's continued through to the present. Since then, we've seen increases in the 18 to 39 age bracket and the other age brackets. And the 18-39 age bracket being the second largest increase in cases. And the other one's more mild degrees of increases in cases. So this shows that COVID is spreading amongst our younger community, and you may have seen news reports about this being due to the B117 variant that is more transmissive and can be more virulent and have a higher fatality rate. And this seems to be consistent with that, although we at the task force don't have variant-specific data to use. But from all reports, I would infer that this trend in the 0 to 17-year-olds is probably being driven by that B117 variant. Recall in the past that this age group would have a lot of asymptomatic cases, so they wouldn't even test positive in the first place. Now it's accounting, the 0 to 17-year-old age group is accounting for the second most cases of all the age groups that we're tracking. Okay, moving on to the breakdown of cases by county. Obviously, Nueces has the most new cases per day on average, but San Patricio has shot up pretty dramatically this week, with other counties in the Coastal Bend, Aransas, Clayburgh, B, and Jim Wells having appreciable numbers of new cases per day. So COVID's still here in the Coastal Bend, everybody. The pandemic's not over yet. Looking at inpatients, excuse me, the number of inpatients has sort of leveled off in the past week. And these black dots represent the number of people in the hospital with COVID-19 each day. If you're in the hospital for 3 days in a row with COVID-19, then you'll get counted on each of those 3 days. So that's just the total number of people in the hospital with COVID. And what you'll notice is that we've had this developing pattern right here where our projection is undershooting the number of actual inpatients with COVID. And that could be due to the hospitals being more lenient in who they're admitting, maybe because there's less stress on the hospital system right now. They're able to provide care to more people that are contracting COVID-19 that normally maybe back in December and January would have been sent home. Another contributor to this pattern could be the new variants that are spreading, especially B117, which has been linked to higher virulence, which could lead to a higher rate of hospitalizations. And that's what this pattern indicates, is that just for every case that we're recording, there's a higher proportion of those cases are becoming hospitalized right now. So for the future, we're projecting that there's going to start to be an increase in the number of COVID inpatients. And this projection is one that's pretty tricky to make. And the reason why is because we are vaccinating a lot of people. There was a good period of time when people in high-risk groups for negative effects of COVID-19 were able to be vaccinated. But there's two things that are happening here that would allow hospitalizations to rise again. One would be people that are at risk and know they're at risk decide not to get the vaccination. That's one option. The other possibility is that people don't know that they're actually at high risk. It's actually, very difficult to know for sure who is going to become hospitalized and who's not from a COVID-19 infection. And so there's plenty of people out there that thought that they were, healthy, quote unquote healthy. You hear this all the time. Oh, I'm a healthy person, so I don't really have to worry about it. But that's not the case. That's not how a viral infection works. It has to do with your immune system. It has to do with factors that are outside of your control for the most part. If you're staying fit, you're certainly at lower risk than somebody who's obese. But nonetheless, you can't know that you're actually at low risk as an individual. So those people also maybe are deciding not to get vaccinated, and then they can also end up being hospitalized. And we have seen, although the numbers are small, we have started to see more people that are pretty young becoming hospitalized than we have throughout the entire pandemic. In the ICU, and I want to point out something immediately here in this plot. The axis is wrong here. This line represents about 148 people in the hospital, so don't pay attention to this 2,000, 1,000. 148 people in the hospital right at this level. And here what we're seeing is on April 2nd, there were 158 people in the ICU without COVID and 19 people with COVID. So first, this 158 number indicates that our ICUs are under low COVID stress right now. They're able to provide the same number of people care as they were before the pandemic really shot up in June and July of 2020. The other thing to notice is despite this low 19 number for April 2nd, on April 1st and those previous days, there started to be an increasing trend. It was fairly consistent. And so I would be on the lookout for this 19 being an anomaly and the number of people in the ICU with COVID staying at higher levels. So maybe we're already seeing an increase here. If we get a couple more days of data, it should be more clear and easy to discern. So the number of people in the ICU decreased today, or not today, but on April 2nd, but it was increasing. And so I would be a little concerned about this trend. If we look at this same figure, but across the whole state, this is the last figure we were looking at. What you'll see is that you have about the same trend all over Texas, with either level or decreasing patterns, or maybe just the slightest indication of an increase, but it hasn't been happening for very long yet. If we just look at the last day, I like this plot because it's very intuitive. If you see a lot of red, it means that our ICUs are under a lot of stress from COVID. If you see a lot of blue, it's more blue skies and less COVID in our ICUs. And so this is the bluest I've ever seen the plot since we started making it. And so this indicates that our ICUs right now are under the least stress from COVID that we've seen in the past several months. Moving on to fatalities. And these are the number of daily COVID fatalities that have been recorded by the state. You can see that it's been decreasing since mid-January, but it's now leveling off. And so the projection is indicating we're seeing a leveling off, and we might see an increase again. Now, the same sort of dynamics that affect hospitalizations also affect fatalities. And I already kind of discussed that in detail, but just briefly, what can really affect this projection are, one, how many people at high risk actually got vaccinated and removed themselves from the pool of people that could die from COVID. Right now, there's about 20% of the coastal bend that's been fully vaccinated. So 20% of the population is not at risk from dying from COVID-19 for sure, from what we know. But 80%, having not been fully vaccinated, is still in that category where they may be at risk from dying. Now, hopefully the people that are fully vaccinated, they're from higher risk groups in general. And so that should help things. But again, there's plenty of people that have decided either not to get vaccinated or not to get vaccinated yet, or they don't know that they're at risk of severe negative outcomes from the COVID-19 infection, and they've decided not to get vaccinated. So that's the way that you can still end up with a projection of increasing fatalities, and only 20% of the coastal bend having been vaccinated. Excuse me. Okay, overall, there's been 1,230 people in the coastal bend that have died from COVID-19. These numbers come from the counts of death certificates by the states where they look for the primary cause of death. If that's COVID-19, they get counted. In Nueces County, that count is at 749 cases. This is a couple days old for Nueces, so maybe it's one or two higher than what we're reporting here. Still, these are pretty large numbers. We're into the thousands, and the question now is, do we keep this below 1,300, or do we let this get out of control again, and do we go up to 2,000? And we would rather not be going up to more than where we're at now. We'd like to keep this number under 1,300. It seems to me that could be possible if we get this current upward trend under control immediately, and we continue to vaccinate vigorously. All right, moving on to vaccinations. So there's been, like I've been saying, about 20% of the coastal bend having been fully vaccinated. And what we're showing here is the trend in the increase in the vaccinations, so you can get an idea of how rapidly they're being added. Now, in the past week, there was a really big jump compared to previous weeks. But if you look over time from mid-February to now, it's an approximately linear increase in the number of, or in the percent of our population that's been fully vaccinated. Something I want to point out here, because there's a lot of numbers that are getting thrown around with the vaccinations. You could have the number of people that got a shot. You can have the number of shots. You can have the number of people that got 2 shots. That's what this is, the number of people that got 2 shots and are thus fully vaccinated. With the percentages, sometimes the percentages are relative to an age group. Now, on the task force, we don't have access to age group related data when it comes to vaccinations. And for COVID doesn't have access to that age group related data either. What COVID notices is whether you've been infected or not so much how old you are or not. And so what we're doing is we're dividing to get this percentage by the total population of the coastal bend, not by adults or people that are eligible to be vaccinated, but this is from the whole population. So this gives you an idea of how close we are of getting to our goal of having 70 to 80% of the population being presumably immune, or at least vaccinated or recovered from COVID-19. So as close as you can get to immune. And we've got a ways to go here. If you look at the percentage of the population that's fully vaccinated by county, you can see that Kennedy is in the lead with well over 30% of their population having been vaccinated, and Live Oak being at the bottom of the coastal bend with just under 15% of the population, and all the other counties falling somewhere in between those two counties. Zooming out to the whole state, you can see that we are now in the coastal bend the most vaccinated area of Texas on a percentage basis, on a population-wise basis, with 19.6% of the population having been fully vaccinated. Now, this is a trend that's been developing through time. We started lower, maybe mid-pack, and each week our bar has been rising relative to the other bars in the state. So I think that that's a testament to the vaccine providers in the coastal bend. I think they all deserve a round of applause from us, as well as the people that are lining up to get vaccinated. Now, here's a little known fact. This week when I got my second shot, there was no line. I walked right in. I didn't wait in line at all. I showed my QR code, and I sat down in a chair, and they put a needle in my arm, and I walked to the next chair. I sat there for 15 minutes, and then I walked to my car. It was absolutely no inconvenience. There were no lines in the car. There were no lines on my feet. And so if you're thinking about whether it's the right time to get vaccinated or not, I'd say it is, based upon the experience that I had. And my first shot, I had to wait 2 hours before I got it, sitting in the car. But this new system that they have with the public health department, it seems to be going very efficiently. So we recommend that you get vaccinated. Last thing that we want to talk about is the cell phone metrics. There's data out there from your cell phones that tracks where you go, how many non-essential visits you make, what the distance is that you traveled, how many other people are you coming in close contact with, and that's, how many other cell phones are you coming in close contact with. And the way that this is possible is if you have a phone with a GPS application like Google Maps or Apple Maps or Waze or anything like that, then you're probably being tracked as long as your GPS is on. And even when your GPS is off, they have the cell phone towers to approximate your location. If you're not happy with this, there's not too much we can do about it on the task force. This is a federal level type of law thing, but you might want to contact your local lawmakers. Now, this data is available to businesses and to scientists, so they can target you with ads. And for scientists, it's available to us to do studies, and we're using it here to show how many non-essential visits and distance and how much distance travel on average is occurring. And what you can see is it's coming down. So what this indicates to me is that we were having a spring break sort of pattern. We experienced a spring break rush on non-essential visits, distance traveled, and now that's coming back down. Now, normal is 100 here on this graph, and what the 100 means is in February of 2020, before we knew that the pandemic was in Texas, we behaved a certain way. Those were the numbers that we saw. So all of these green, red, and blue lines would be at 100 in February of 2020. Now you can see where they are. People are avoiding encounters with other people. They're social distancing. Here's the proof right here. They're avoiding crowded places. It's down by 1/4 the height of this, or the amount of encounters that are occurring relative to before the pandemic. Now, in terms of distance traveled and non-essential visits, we're pretty close to normal. We'll see how much more these come down. Maybe we'll come back to this kind of 75% of normal pattern where we were at before spring break, or maybe we'll end up at some higher level closer to normal. Either way, these can't know whether you're wearing your mask or not. If you're wearing your mask, the chance of transmission is decreased dramatically. But just from having lower encounters, that decreases the chances of transmission. Overall, it looks like these are moving in the right direction for decreasing transmission right now. And overall, the encounters being down at around 25% of normal is a good sign that transmission won't continue to increase like it has. All right, in summary, new cases are increasing, hospitalizations and fatalities are leveling off after having decreased for several weeks. Cell phone metrics, while they increased over spring break, they're declining again. So maybe this indicates that we won't see a sustained increase in the transmission rate. That remains to be seen, and depends on our own behavior. And here's where we come in. We, as a community, as a population, are relaxing faster than we're getting vaccinated. It's as simple as that. That's how you get these increases in transmission rate, because if we were relaxing at the same rate that we were vaccinating, then we wouldn't see a change in transmission rate at all. It would stay the same. And if we kept relaxing, if we just kept the same level of vigilance while we were getting vaccinated, the transmission rate would continue to go down. And so right now that the transmission rate has been increasing, it indicates that we're trying to go back to normal too quickly relative to the rate of vaccinations that are occurring. So you're encouraged to stay vigilant, get vaccinated if you can, double up on the face coverings if you have a surgical or a cotton mask. The surgical cotton mask combination gets you up to a 92 on that KN or N95 scale, which is pretty good. And Again, multi-household celebrations are discouraged. If you're going to a sporting event or to a theme park or anything like that, these places that are starting to open, just follow the rules. It's really simple. They're open. They want to have business. They want to help to entertain you, but they also want to keep you safe. And so if you follow the rules, then that's the best way to make these things work and to be able to continue to move towards something that's more normal while combating the spread of COVID-19. All right, that's the report for this week. I want to remind everybody that we welcome your comments and feedback on our social media accounts, Facebook, Twitter, Instagram, YouTube. Our handle's at CBCovid. It's pretty easy to find us. On Fridays at noon, we address your questions live from the whole week, and we don't avoid any of the questions. We ask, or we answer all the questions. You also have a chance to ask questions live on Fridays. So if you want to give us a gotcha question or anything like that, hit us up on Friday during the live Q&A on Facebook, and we'll be happy to answer it. So that's the report for this week. I hope everybody has a safe weekend, and we'll see you next week.